Welcome to Psych Talk. I'm your host, Dr. Jessica Rabin, a licensed clinical psychologist. If you are a mental health professional, student in the social science field, or just interested in psychology and mental health, this podcast is for you. Although topics discussed on this podcast are similar to therapy, Psych Talk is not a replacement for therapy and is for educational and entertainment purposes only. So let's dive into today's episode. Hey everyone, welcome back to Psych Talk, and thank you so much for joining me for today's episode. Today I have a very special guest with me, Dr. Christy Gibson, who is a family doctor, trauma therapist, speaker, and author. So Dr. Christy, thank you so much for being here today.
It's my pleasure, Jessica. Thanks for having me.
I am so excited to chat with you today. As we were saying before we hit record, we scheduled this a while back, so I'm glad the day is finally here to sit down and talk with you. But before we dive into our discussion, can you introduce yourself, a little bit about your background and what you do?
Sure, yeah. So I am a family physician and I work currently at the refugee clinic and in adult addictions, but I historically have done hospital-based practice. I ran our health equity residency for a long time, and I've done quite a bit of international work. So the reason I say all of that is it's kind of the confluence of how I ended up doing trauma therapy. I was caught in the earthquakes in Nepal in 2015 while I was volunteering with the medical school there, and that just led to quite a lot of symptoms that I now understand to be like post-traumatic symptoms.
Mm-hmm.
And I was really curious about what was happening in my body. And the more that I started researching, a friend, Sima, taught me about polyvagal theory. And I was like, wait a minute, as a hospital-based doctor, my body is caught in like an overload of sympathetic tone. And then when I moved into community to do primary care, of course, I was working in an equity denied environment. And I started to recognize just how much trauma was playing a role in everything that I was seeing. So I started learning a little bit about trauma about 8 years ago and started doing some like memory reprocessing work with some of my patients, and their physical health improved dramatically. So
Wow.
things like diabetes, asthma, blood pressure improved in ways that no medication could have touched. And that got me super curious.
Yeah,
So
absolutely.
I started to learn many more modalities, kind of spent full-time learning, ended up getting a doctorate, studied lifestyle medicine and a lot of just somatic-based stress reduction methodologies. Because, like, for me as a physician, it was really, I had learned a lot of cognitive therapy, but what I was fascinated that was working was how to rewire the nervous system. So that led me to becoming a social media educator as TikTok trauma doc and book deal. So I wrote the Modern Trauma Toolkit 2 years ago as a primer to just, in really gentle and accessible language, explain to people what was happening in their mind
Mhm.
body and be really solution focused. Because I think a lot of the patients I work with would be frustrated reading a book and saying, yeah, that's my problem, but now what do I do about it? So
Mhm.
I wanted to give them some skills that they could at least turn the volume dial down on those symptoms. And having experienced them myself, they worked for me. Like I would be
Mhm.
studying all these practices and um, healing myself too.
Wow. Thank you so much for sharing that. And, I don't know exactly when you started becoming a physician, so I apologize if this is an incorrect assumption, but it sounds like you were practicing at least for a little bit before all this trauma work came
Oh yeah,
about.
like
Is that,
I've
yeah,
been a
okay.
hospitalist for, I wouldn't say, because I still kind of continued on the path for a little while, even though I realized my own nervous system was so
Hmm.
hijacked. But yeah, I'd been doing it for 14 years when I had that earthquake
Oh,
experience.
wow.
And then
Okay.
I was like, okay, I need to heal my own nervous system. And a lot of
Yeah.
the skills that I was acquiring for a long time was just trying to work on the fact that my sympathetic nervous system was so hijacked.
Hmm. Yeah. But then it sounds like you realized it helps your patients as well. And obviously, you're helping a lot of people through social media as well, which I'm sure we'll touch on at some point. So I'm I'm not glad you experienced an earthquake. I don't think that's the right way to say it, but I'm glad that experience kind of led you to where you are today.
Yeah, I am too. I mean, we never kind of know what these forks in the road will lead to. And the earthquake was devastating for the country of Nepal. So I feel a real affinity for this place where I've spent quite a lot of time. And one of the many lessons I learned around like post-traumatic growth
Hmm.
was just how the community responded in Nepal. So there's just been so much learning for me um,
Yeah,
around that. So I'm very grateful.
absolutely. So, to start our discussion, I always love to define terms on this podcast so that all of us know what we're talking about. So, can you define for listeners what trauma is? And then, as a secondary question, you mentioned polyvagal theory. And so, feel free to share a little bit about that. But really wanted to know what the two main trauma responses are according to polyvagal theory.
Yeah, I'd love to share about this. It's not the most perfect theory, but it is such a good clinical explanation. If I'm trying to explain to somebody in front of me, how do you befriend your nervous system? This is a really easy way to explain it. And my goal is to help people really understand things in simple
Hmm.
terms. So the way I define trauma is the process that happens in our body as a response to an event. And these events don't have to be an earthquake or a natural disaster. These events can be relational events. And
Hmm.
these events can also be events that we inherit through our genetic code. So sometimes we can have a trauma response without having the language for it. And it's because we actually inherited it or it happened in a pre-verbal way before the age of 3. People can experience traumatic birth and it gets stuck in their body and they don't have language for it, obviously.
Yeah.
And that's what I love so much about these body-based ways of moving trauma because we don't always have a language. And trauma is not the event, it's our physiologic response to that event. So
Hmm.
we could have 100 people surviving that same earthquake, and that event will land different in everyone's mind body. We can have 4 kids in the same family growing up with the same stressful environment, and all 4 of them will have very different strategies and nervous system responses. So it's really important to me that people understand that these are personalized reflexes
Hmm.
and that we also need a personalized toolkit, which is kind of the tagline for the modern trauma.
Yeah, I love it. I love it. Yeah, I think one thing I have learned also being on social media, I started during the pandemic. I'm not sure exactly when you started. Was
Yeah,
it
me
around
too.
the same time? Yeah, that's what I thought.
Because
Okay.
everyone's on the struggle bus. Why don't I join you?
Um, but what I learned was, trauma, the term is thrown around a lot, but a lot of people didn't necessarily realize it is our response or how trauma affects our body because everybody, could say there are certain events that most people would define as quote unquote traumatic, but exactly like you said, 100 people could go through the same exact earthquake, which I think a lot of people would probably label as a quote unquote traumatic event, but some people don't have that same bodily response that
Yeah.
makes them hypervigilant or their nervous system in overdrive or whatever it is. The example I always give working in a hospital is two people can be in the same car accident and
Yeah.
respond completely different. One avoids driving at all costs, one gets out of the hospital and gets into a car no problem.
It's interesting. One of the first places that I studied trauma was a book called The Body Bears the Burden. And this was a rehab specialist, like a physiatrist, who was working with car accident victims who had suffered whiplash. And he recognized that like a certain percent of them would have PTSD. And he was trying to like delineate, well, what were the risk factors within the event and the risk factors within the person. And so that was one of the first places that I started studying. And because his book was written quite a while back and polyvagal theory has really come into the forefront, I'd say in the last 10 years, but really in the last
Hmm.
5. So I was kind of one of the early people studying it because I'd studied like the safe and sound protocol, which is like
Hmm.
listening to different things in your ears. And one of the ways that I would describe to patients what it was happening to them, which I think was just really helping them find some self-compassion, because I think that antidote to shame and like to not understanding the reflexes that have been set up in your body is self-compassion. And that can be really hard for folks to achieve. But if they can understand that these responses are reflexes, I think that's a really good head start. So I'll explain. Um, just like every mammal on the planet, we are wired to go into our sympathetic nervous system, which is the nervous system of movement,
Mm-hmm.
to move our way out of an event. And the problem with humans is, unless we're in something like a car accident or a natural disaster, it can be really hard to extricate from the event, because the event is our work situation or our
Mm-hmm.
caregivers or even our children. And it's hard to extricate from these relationships that we can experience as traumatic. So what ends up happening is we get stuck in this overactivated response, which takes a lot of energy because our body wants to fight and flight, and there's no opportunity to do it. So once we've spent enough energy, we then tip into the underactive response. So I don't use the terminology from polyvagal theory, because if I were to say dorsal vagal, my patients would look at me blankly. But what I say is your nervous system has been stuck on for so long that it's just overwhelmed,
Mm-hmm.
and it shuts down because it has no energy left. And so that looks like you can't get off the couch, you're doom scrolling, you're on socials, and there's just like a heavy lack of momentum kind of feeling
Mm-hmm.
in the body. So we talk about the overactive response as being too much energy, restlessness, agitation, can't turn the brain off. And then we talk about this underactive state. And generally, like in my first kind of psycho ed, I explain to patients what I know about trauma. They'll be able to identify, oh, yeah, like I'm stuck in overactive, or I'm stuck in
Mm-hmm.
underactive, or I pendulate all day. And that awareness helps them understand how much of what's happening is a reflex. And it's
Mm-hmm.
not been in their conscious awareness. It's not been in their cognitive control, which is why all these cognitive therapies they've tried have not worked yet.
Worked. Yeah.
Um, and we have to bring the nervous system into the window of tolerance before they can access their cognitive capacities again, or that thinking brain response. So that's how I explain it to
Mm-hmm.
folks. And it's just such a nice, gentle, compassionate explanation. So it does tend to land. And that's what I love about the theory.
Yeah. Oh, absolutely. And listening to you speak, I think also highlights how people respond differently, which we've already highlighted. But like I've heard from many clients, so and so went through the same thing and they're not responding this way. Why am I? Like something wrong with me? You mentioned self-compassion, but I think it could be good for psychoeducation. I'm even thinking like in family systems, say the family went through a trauma and there's a
Yeah.
couple people really like in that overactivity, overdrive. There's some people that are completely shut down and neither is a right or wrong way to respond. Like that sounds so
Yeah.
weird saying out loud, but I think a lot of people think there's a right or wrong way to have a
Well, and
trauma
there's a
response.
socially acceptable way too. Like it's
Correct.
kind of not socially acceptable to be stuck in bed and you can't go to work and your doctor's calling you non-compliant because you're not coming to your appointments.
Mm-hmm.
And so now that I have that lens of the dorsal vagal, or this like underactive nervous system response, it was really helping me see how so many of my patients in these equity denied communities suffering from like poverty and a lot of structural stress, they were stuck.
Yeah.
And that freeze collapse response isn't something that enough practitioners um, understand where it's coming from and know how to help people move through it.
Mm-hmm. Oh, absolutely. And I love that you highlighted even just your own experience, like how this learning helped you see and help your clients better? Because I think a lot of times we do,
Yeah.
like, we just see the outward behavior. I mean, I can acknowledge this as a psychologist as well, especially one that works in a hospital. It's like, oh, they're not showing up to appointments, they're non-compliant, or, I gave them all of these tools or resources to help them and they're not following through. It's like, okay, well, maybe they can't, whether that
Yeah,
be to,
totally.
structural barriers or just exactly what you were saying, their body has completely shut down. So getting out of bed is difficult to them for them, they're not going to be able to go out and do X, Y, or Z for their physical
Yeah.
health that we've asked
Yeah.
them to. So you started talking about your experience with specializing in trauma from the earthquake that you experienced, and that gets into this idea of collective trauma. So, and I know this is something you talk about a lot. So, can you define for the listeners what collective trauma is and how the responses to a collective trauma may differ from a trauma that is, say, more individualized, if that makes sense, the way I worded that?
Yeah, no, for sure. One of the many things that I've studied, because I love studying all the things, is climate psychology. And I kind of think this is one of the areas where we're not acknowledging the collective trauma of, the climate catastrophe, especially when and I know for certain countries it's like policy to deny it,
Yeah.
but and yet we experience it. We're experiencing these like massive weather events and these like one in a lifetime events. We're experiencing these changes, and I think the canary in the coal mine is an entire generation of like
Hmm.
Gen Alpha who is saying to us through research, I'm not okay. So you and I both acknowledge we joined socials during the pandemic when people were more visibly struggling. And
Hmm.
like since then, we've heard organizations say there's a lack of emotional regulation at work and people's stress
Yeah.
responses are showing up on the job site. So I run a company, Safer Spaces Training. We do workplace kind of occupational psychoeducation around that. So the pandemic, this like change in the way that we kind of collectively express ourselves. Like I still mask in really public places, and that triggers people because they don't want to think that there's still a pandemic going on.
Hmm.
Um,
Oh, yeah.
we've got smoke season where I live in Western Canada, where instead of summers, we often just have these fires sweeping through the west and kind of blanketing.
Wow.
Our air is like ash for most of the summer now. So it is in our faces. I mentioned, policy, like political divisiveness is a collective trauma that
Hmm.
almost every country is suffering right now. So all of these things that we experience kind of universally as humans, some more dramatically than others, because so many of these equity denied communities are placed at risk, and they're the ones that are suffering the effects of climate far more than those of us
Hmm.
that can kind of use our privilege and other kinds of wealth and resources to mitigate the changes that we would otherwise experience because, hey, we can still get air conditioning. But then all of a sudden it's like, wait a minute, I'm in a privileged place. There's rolling blackouts. What?
Yeah.
Um, and so one of the things that I thought was really important when I was studying climate psychology was a study in the Lancet in 2021 by a large group of researchers that studied 10,000 youth between the age of 16 and 25
Okay.
in 10 different countries, including like, Philippines, Kenya, United States, places in Europe. So you can see that this would extrapolate amongst a lot of different
Hmm.
places. And they got similar results from all of these surveys where 75% of youth felt their future was frightening. And that
Oh
was
my
from
gosh.
climate. So the youth are telling us, like, this is happening. And
Hmm.
then, like, the boomers or like whoever's kind of making policy decisions are disconnecting from that reality. So we're getting these two kind of polar extremes. And I actually think of it as the youth saying, hey, I'm in fight and flight. Could somebody please rescue me? This is really scary. And
Yeah.
then these people in leadership that are disconnecting, they're in that dorsal vagal response where I'm going to just dissociate from the reality in front of me because that's easier to deny it's happening and to just
Hmm.
kind of disconnect from that. So I think of that as more like a freeze collapse response. And so my most recent TED Talk last year was on how our non-response to the climate emergency is actually dissociative. It is really a trauma response. And so when I think about collective trauma, it's these things that are universally experienced, by humans. And we also have these kinds of collective responses that lead to policy, that lead to worsening inequity, and there needs to be collective solutions. But if we look to trauma therapy, we can often find those.
Hmm. Thank you so much for sharing all of that, the research. And yeah, I know. I think when it comes to collective trauma, a lot of people, just like trauma in general, a lot of people have those few things that they might think of. Oh, like, oh, a hurricane or a earthquake, the example we started with. But, you know, climate change, I mean, the pandemic, I always bring up as a collective trauma. I know you do a lot of equity stuff, so we'll probably touch on this, so I don't want to get too into it, but like socioeconomic inequalities and things like that.
Yeah.
Or collective trauma. And I would imagine, and I am not a trauma expert like you are, but going back to something you said earlier, unless it's like a single event, we're continuously living it. And with a collective trauma, yeah, you have other people also living it. But for many of these things, it's continuously ongoing. And so I imagine for your nervous system, that is extremely difficult.
Yeah, absolutely. And I think about like kids who grew up and had to experience the pandemic in a more like kind of visceral way when school was canceled and they couldn't do
Mhm.
sports or see their friends. Like the future feeling frightening is kind of one of the definitions of trauma. If we think about PTSD, you mentioned hypervigilance, but there's avoidance or trying to avoid triggerings and cues. There's intrusive symptoms like flashbacks and nightmares. So somebody showing up somewhere in a mask is one of those cues. And then there's this shift in the negative worldview, or like, am I safe? Is the world safe?
Mhm.
And a lot of people are starting to like, when the air that we breathe is either full of smoke or full of germs, that does not feel safe. So this like sense of whether the world is safe has shifted for many of us. And I think that it makes sense that a lot of folks are kind of in denial about that, and a lot of folks are feeling more activated because of it. And what we want to do is to be like authentically in touch with these very real risks in front of us as humans, and also try to stay within that window of tolerance where we can move forward and cope um, and actively work towards solving these problems.
Mhm. Oh, absolutely. So, how can communities enhance their resilience? I was going to say after experience of collective trauma, but also given the examples you gave, even like while going through a collective trauma, if that's
Yeah,
makes
and the
sense. Yeah.
term that we often use in climate psychology is like a pre-traumatic stress, where you
Okay.
kind of something's coming. Like, let's say you live in Miami, you're probably experiencing some pre-traumatic stress, and that's
Yeah.
probably manifesting as fight or flight or freeze
Hmm.
collapse. So there, this is something that we can kind of take the individual response and demonstrate how it's happening in the collective. So, I think the solutions really happen starting at an individual level is for us to have more awareness. So I
Hmm.
call this interoceptive capacity, but it's basically how am I listening to the messages that my body is sending my brain? So this
Hmm.
happens through the vagus nerve. So the vagus nerve is supposed to be like a downward signal, helping your mind body regulate um, through kind of attenuation of the sympathetic response. But what happens when we get stuck in trauma is those signals are really coming up through the body to the brain. And so then the vagus nerve is kind of going backwards. And it's a part of that signaling pathway saying, hey, like my heart's pounding and I'm sweaty. And like, how do you interpret that, brain? And then the brain takes these signals and perceives them based on past experiences,
Hmm.
cultural interpretations, genetics, like all of these things is a part of how we perceive stuff. So there's many places where we can interrupt the pathway. We can attenuate or turn the volume dial down on those physical symptoms. So
Hmm.
we can do things through like neurofeedback and biofeedback, and a lot of the skills that I teach on socials and in the Modern Trauma Toolkit, like havening and tapping, these are just ways we turn the volume dial down. And
Hmm.
every human could learn this. I'm really advocating that these skills be taught in like schools, and parents learn them, because I think a lot of people are their volume dials are just turned up really high. So we
Absolutely.
can attenuate the message itself. We can attenuate how the message is traveling through the vagus nerve. And then we can attenuate the perception. But it's harder to get to those perceptions unless we have our thinking brain online again. So when our amygdalas are telling us, hey, brain body, you're in danger, this organism needs rescuing,
Hmm.
our cognitive capacity kind of goes offline. And that's why I also think part of my messaging towards the profession is like, if you only have cognitive skills in your toolkit, you probably need a little bit more.
Mm,
And I'm not going to tell you what those are, but like my practice is studying all the things because then I can kind of teach that through socials and write about it. But I think many practitioners should have some somatic and cognitive capacity for
mhm.
helping their clients and patients work through things.
Oh, I absolutely agree. And you beautifully set me up for the next thing I was going to ask you about because you did mention earlier, like when you're in that like freeze response or you're in that fight or flight response, you can't access the cognitive. Like you can't do the higher order thinking processing. And you just mentioned as you were going through some interventions or skills you like to use. So, what are somatic therapies and how can they aid individuals who have experienced trauma? And feel free to share some interventions if you want, but it's up to you if you want to do that.
Yeah, no, I'm happy to. I'm such a huge fan of, this exploration and the evidence is becoming more and more robust. So when I first started exploring this like 8 years ago, there was kind of scanty research, but it's
Hmm.
just improving. So the very first modality that I learned was accelerated resolution therapy. It's kind of
Hmm.
a cousin of EMDR. The founder was an EMDR practitioner, and she kind of used some of the pieces of EMDR, such as bilateral stimulation or moving the eyes from side to side. It's basically crossing the midline of the brain and engaging both lobes. So there's something that we now understand through research. It enhances your delta and theta waves, which is the relaxation response. Let's say I were to stick at EEG monitors and measure your brain waves.
Hmm.
An activated response that's in fight and flight is full of gamma activation. So it's really choppy, fast brain waves.
Hmm.
And delta and theta waves are like slow, rolling, like very, very chill. You're sitting on the couch thinking about your day, you're half asleep. That's what your brain looks like. So we know through research now that one of the reasons why moving your eyes from side to side is it activates that delta and theta brain waves. But like when Marsha Lynham was like in Central Park looking at the trees on the side of her path and created EMDR, or when Lainey Rosenzweig's from accelerated resolution therapy was like, we're going to use the bilateral stimulation, like the science is just catching
Hmm.
up. So a
Yeah.
lot of the skills that I do, like havening techniques, that was used because they would take these people in the lab, measure their EEG, and see what was decreasing the gamma and increasing the delta theta waves. One of the things was moving the eyes from side to side, and another of those things was gently brushing the body on the
Mm.
palms, the shoulders, and across the face, which again makes sense because we're just overly complicated mammals, and like dogs and cats and horses and cows like to be pet.
Hmm.
So does our body. So we can
Yep.
actually kind of gently brush across these surfaces and cause some relaxing brain waves and shifting towards a more parasympathetic state. So it sounds really simple, like just,
Yeah.
gently brushing across the shoulders and um, using some guided imagery or some distraction techniques, maybe some breath work,
Hmm.
and yet it's so effective. So that's really exciting to me. Likewise, EFT tapping, when I first studied it, the community health center where I was working was like, what is this thing? And
Hmm.
I had learned it from some of the other doctors, but it was almost kind of like underground that we were practicing it. And now there's like robust evidence around
Hmm.
anxiety and chronic pain. There's getting to be more around trauma. EFT tapping is self-acupressure. It's a part of traditional Chinese medicine where you're tapping on these energy points and you're helping a person turn the volume dial down on these big stuck physical sensations, and those
Mhm.
sensations is what we create emotions from. So you're turning the volume dial down on emotion. So I share these skills readily because I think they are effective. The evidence base is definitely improving. And the more that we use the body as the doorway to modulate these trauma responses, the quicker access we have. So other modalities I've studied are like brain spotting or deep brain
Mhm.
reorienting. And Frank Corrigan is the psychiatrist who beautifully explains, using lots of big scientific words, how there's an orienting reflex that happens in the brainstem. So far beyond the level of conscious awareness. And within that brainstem, at the time of the event, we were orienting to the event. So we moved our neck, we moved our forehead muscles, we moved our eyes towards the event. And that is one of the ways that we can access the event. So both brain spotting and DBR are kind of predicated on that physiology.
Mhm.
So I love explaining this stuff because even though there's some folks that are like, oh, you know all these woo-woo techniques, I'm like, oh no, wait until you understand the basic
Yep.
science. I'm a total nerd. I love to talk about neurophysiology. And also, I love to share you in like a minute how you can use some guided imagery or enhance your exhales and really shift your nervous system quite quickly. So there's two sides to that coin. There's the bridging of like the hardcore science,
Mhm.
and then there's the bridge of like these are the skills that every single human could easily acquire.
Yeah. Yeah. I love all that. Thank you so much for sharing so many techniques in such a short period of time. And I love that the research is catching up with these techniques. Because I mean, I even remember 5 to 8 years ago, probably learning about EFT. I'm trying to think. It was definitely before the pandemic. So it was probably like 6 to 8 years ago. And I was like, what is this? Like, and the person that like was teaching me, like, as she was a friend of a friend, I was like, this seems kind of cool, but like, and I was trying to look up and there wasn't really any like
Yeah.
evidence base. And being a clinical psychologist by training, I will say I have deconstructed a lot of stuff. It's like, no, you need to look at what the research says. Where's the evidence? And, I don't know if it was the pandemic itself and maybe also just me connecting with other mental health professionals and professionals online, or it was a natural shift. But I definitely think in the past 5 years, I've seen a lot more people who work with trauma or mental health in general, or even physicians that are advocating, like, yeah, we have these like modern medicine, evidence based practices, and we need to also be looking at these body based practices. Or, like you said, EFT goes back to acupuncture. Like, Chinese medicine has been around, I don't even know how much longer than modern medicine, but obviously
Yeah,
it
like
works.
I would say around 5,000 years. And it's interesting
Okay.
because one of the things I studied before I got interested in trauma was Ayurvedic medicine. And once I learned polyvagal theory, I'm like, oh, wait a minute, isn't that just the gunas? So like the knowledge of polyvagal theory. So in in Ayurvedic practice, the gunas are kind of our mental state. And so sattvic is
Hmm.
a state of calm and connectedness and kind of that place where we can achieve self-actualization, this sense of interconnectedness. Tamasic states are very heavy and dull and depressed, and
Hmm.
Rajasic states are very energized and anxious and overwhelmed. And so they would describe mental health using that lens from, like, we're talking 8,000 years ago when the Vedic texts were written. And then all of a sudden, somebody reinvents polyvagal theory in the 80s with Stephen Porges, and it really does completely connect to the gunas. So I
Hmm.
don't actually think a lot of what we learn is new. In the Modern Trauma Toolkit, I also explore like what did we used to do as humans that was collectively healing trauma, and we used to chant together. We would
Hmm.
sing in like religious or sacred ceremonies. We did circle dancing. We lived like collectively and kind of um, shared experiences, shared resources in very different ways than this kind of like individualistic societies that a lot of us in the Western world find ourselves in. And that collective was healing. So
Yeah.
part of what I love to explore is like, what have we always known about trauma? And I also push a little bit back against evidence-based medicine because when I think about the history of that, there's a lot of structural trauma there too, in terms of who was experimented on, in terms
Absolutely.
of the pharmaceutical companies dictating what research gets done and then suppressing the stuff that's like not
Not
showing
good.
evidence for what they want to be proving. So like evidence-based medicine also has a lot of problems, and
Mhm.
there are certain things that are just not amenable. Like one of the first techniques I learned was TRE, or tension trauma releasing exercise. And it's the way that our body kind of tremors naturally. It happened to me once after a car accident where my body was just shaking so hard after, and I couldn't even walk. I couldn't control it.
Oh,
And it was interesting that this social worker working in Lebanon and other war-torn regions uncovered that if a person tremors immediately after the event, so like the bombing or something major, they were less likely to have PTSD. So the tremor was kind of
wow.
protective. And so he teaches people how to tremor as like a way to release your sympathetic tone. And I
Okay.
didn't think my body would like weird, like just randomly tremor, but it turns out almost everybody does this. And we are
Interesting.
naturally conditioned to tremor to release our sympathetic tone. So if we can't fight and flight, that tone builds up in our muscles. And tremoring is one way that we can naturally release it. And we are actually designed to tremor. You could have knocked me over with a feather, but how can you study that response using a randomized clinical trial? Like, what's the
Yeah.
opposite? What's the placebo to tremoring? Like, you either are or you
Or you're
aren't.
not. Yeah.
So, there are so many of these beautiful somatic techniques that are not amenable to RCTs, and
Hmm.
then modern medicine kind of like dismisses them. And I think we're really missing out on a lot. Like, even the way that psychedelic medicine is like hugely beneficial when it comes to
Yep.
PTSD. And yet they're like, oh, well, we don't really like your phase 3 clinical trials because there was no adequate placebo. Because there can't be a
Can't be.
placebo.
Yeah.
Like if you're on a hallucinogenic, you know it.
Like, you're gonna
So
hallucinate. Yeah.
yeah,
Like,
so when they say, well, we're going to dismiss all of your level 3 clinical trials because the placebo was obvious, how can you get around that? So
correct.
there's a lot of problems within like the medical practice that I think we've just gotten too entrenched into these like ways of being and knowing that we've
Hmm.
disconnected from our ancestral ways, our natural ways, our creative ways, and our somatic ways of knowing.
Yeah.
Like, if a psychedelic has like worked on your PTSD symptoms,
Hmm.
if tremoring helps you release sympathetic tone, and there's more than one way of knowing. And I think one of the many systemic things that I push against, because I talk a lot about individual and systemic responses to trauma. And one of the systemic things I push against is like, it's not all about the RCT.
Yeah. No, I love that because I completely agree with you. I mean, it's like in obviously clinical psychology, people will always be like, "Oh, CBT has all this evidence base." I'm like, because CBT is probably the easiest therapeutic modality to study because it is
Oh,
so
for sure.
structured. And that's why there are a bajillion RCTs on it because it
Yeah.
is very easy to study. And like,
And
I'm not
yeah,
saying there's no utility or there is utility, but I'm just
yeah.
saying, like, compared to a lot of other therapies, the cognitive therapies are very easy to study in RCT.
Yeah. And then the other major problem is we're not doing RCTs on complex trauma because there is no universally defined clinical definition of it. So
Yeah.
we can study PTSD because there's like, I went through the definition earlier in our talk, but I actually can't tell you the definition of complex trauma. I can tell you what the ICD-11 diagnostic code says, but this isn't something that's really translated well into research studies. So I'm currently working on like a complex trauma assessment tool, and like the lack of this within the literature is one of the things that holds us back. So there are so many things that are difficult to study in traditional ways, and I
Hmm.
think we really need to open ourselves up to these other ways of knowing and being and researching and understanding, because it hasn't been working. Like if I try
Hmm.
to use CBT on a lot of my patients, I will enhance their shame by talking about their distorted thought
Thoughts.
processes
Hmm.
and the things that need fixing. Whereas if I use let's say the NARM model, the neuroaffective relational model, which is also a cognitive model for developmental trauma. But what it all asks in a really different way is, well, why does this make sense? And
Yeah.
why is this right? How has this been benefiting you, these responses that you've been through? And then we look for exceptions or like times where you've experienced agency or a sense of control over your
Mhm.
response. This is such of a less shame-based approach, whereas cognitive behavior therapy will oftentimes make a person feel like my distorted thoughts, there's something wrong with me.
Mhm. Mhm.
And it's sometimes compounding that shame, which is such a thread in trauma. So I'm really careful when I use which modality. And it's not to say I never use CBT because I'm a huge fan of acceptance commitment therapy, which
Yeah.
is the many branches. And I will sometimes use that in the integrative phases where I'm like, let's redefine your values and who you want to be
Yeah.
now that you're not so driven by these reflexes. There's definitely a place for it, but to say that there's like one tool fits all, which is really what I studied as a family doctor, is like
Mhm.
CBT fixes everything. Um, let's all expand our toolkit.
Yeah. Absolutely. Absolutely. So, another passion of yours is health equity and systems change, which I can already hear throughout our discussion so far.
Yep.
But what are some issues of equity individuals and systems currently face? Like, what are some of the main things that you're seeing in your practice and work?
I mean, I work in equity denied populations, so I work in refugee health. So obviously, um, just the refugee phenomenon and like where are they even allowed to go now? Even Canada, which I mean, we've historically been so great at taking in refugees, and we've lowered even the privately sponsored refugees where the government doesn't have to, you know, provide the resources. Even
Yeah.
those ones are down 30% for next year. So like
Wow.
we in the Western world are much more responsible for the financial and resource-based inequities that are faced in the global South, and yet we're not taking accountability for that. So, I mean, if I could talk about refugees for a really long time and kind of
Yeah.
describe what that looks like. Um, I, right now, just the things that I see clinically are folks who are struggling with housing security, food
Mhm.
security. They can't pay all of their bills, so they're trying to decide like, do I pay the electric or do I pay the phone? Like, just the cost of living has dramatically increased for so
Mhm.
many folks. Food. I mean,
Yeah.
one of the things we don't talk about, but it's totally related to climate change, is most agricultural production in the world is down on average 30 to 50%, depending on the crop and the location. It makes sense that the cost of food is skyrocketing and that the policy is allowing these billionaires to keep increasing prices even beyond what's necessary so that they can increase their profit margins because their stakeholders expect it. This growth mindset is so harmful. And I think the more that we do get back to like indigenous and ancestral ways of being and knowing, the more that we can intervene at a collective level. And one of the things that I did when I was doing primary care, I was allowed to do kind of some system level work, and I ran a social innovation lab, which allowed folks with a lived experience solve their own problems. And I included that in the Modern Trauma Toolkit because I kept thinking like once we have the ability to be in our window of tolerance, what do we then do? And I wanted to give people processes for solving complex
Mhm.
problems. And the solutions exist, the processes exist. And so once we have more of that cognitive capacity in our thinking brains back, and we start to work more collectively on problems, because I think a lot of what ends up happening is the people who are in charge of like government policy or industrial lobbying, they have so much control. Whereas community, especially when we work as, you know, a collectivist community, we actually have more control than we think, both
Mhm.
in terms of our voting and buying power, but also just the things that we can do locally. And it was really remarkable the kinds of problems we were able to solve related to health and mental health just within Social Innovation Lab that I studied social innovation and kind of systems design as a part of my sense of what is needed to do from like a pre-traumatic growth perspective and how we can solve complex challenges. So I'm really deep into like complexity science. I did a lot of
Yeah.
exploration on this in my doctorate, but it kind of plays out um, at the level of how do we solve these things? We
Mhm.
really rely on community-based solutions, some of
Yeah.
which have been present for millennia.
Yeah. Oh, absolutely. And the next thing I was going to ask you, which you've already started to touch on, and I know this could be a whole episode within itself, but like, what are some of the big systems changes you feel need to occur to improve health equity and overall health outcomes for individuals? And I'm smiling because I know
Yeah.
like this could be a whole episode within
Well, yeah, and this
itself.
is probably where some I might lose some of your listeners because I'm a bit of a raving socialist. And I mean, I say this as a person who is very generous with my money. I
Yep.
probably donate almost half of what I make. So I practice what I preach.
Hmm.
Like we can't have the ultra wealthy that
Hmm.
especially we can't have them making decisions because they seem to keep compounding their wealth. Like the inequity has vastly increased over the last 20 years. Even within the pandemic, the people that were middle income were worse off, and the billionaires ran away with all our
Yep.
money. So we really need to change policies around that. Um, the elite are already telling us that they anticipate massive job losses because of AI. And then the amount of grid that AI and crypto are taking are worsening the climate emergency.
Hmm.
So all of these things need solving in community-based ways that benefit the whole. And I think we need to bring into, like, I'll say universal basic income, but there's kind of like a subset of that where you don't give the money to the billionaires. So, like, it's a general basic income where everybody who has some need has their needs met.
Hmm.
So, like, we all need and deserve, like, it should be a human right to have food, shelter, clean air, clean water. Um,
Hmm.
and a sense of purpose. So, like, these are basic human rights that many folks around the globe, even within very wealthy nations, don't have access to. And in Canada, the biggest divide is among Indigenous communities where we're not fulfilling our treaty obligations. So, like, these universal needs need to be taken care of for every human globally first.
Hmm.
And then we need to kind of start looking at where the impacts are the biggest and take some accountability for that. So, a friend of mine just came back from India and she said the air quality was so bad that they would often like hang out in their hotel room because even with a mask on, the air was massively unsafe to breathe. I
Wow.
was in Toronto at my med school reunion in June, and the AQI, like the air quality
Hmm.
index, greater than 9. Like you could see pillows of ash floating around in the air.
Oh my
And people were just
gosh.
walking around outside like everything was fine. So we need to create policy that helps people live with the situation that we're in. So much of it is like mitigation and so much of it is adaptation. Like this is what we're locked into, but how do we like collectively acknowledge these big problems and work to solving them as fast as we can?
Yeah.
So we need to divest from fossil fuels. We need to divest from meat-based industrial agriculture and start working on regenerative permaculture. Like, I'm a physician and I've studied these kinds of things just at a really superficial level, but these are the policies that need to happen. So
Hmm.
it's not that we need to become communist. Like, I'm not saying that, but we really
Hmm.
do need equity-focused policies,
Absolutely.
or like we won't have a livable planet in 20 years. And the kids know
Just,
it. Like
yeah.
that Lancet study 4 years ago proved that they know what they're inheriting, and we need to turn things around, um, for the betterment of all humanity. Like, even though the ultra wealthy think they might fly off to Mars, like we all need a very livable planet, and part of that livable planet needs to encompass a more collectivist mentality. So, who are the elders? Who are the indigenous? Who are the refugees that we could be listening to that have already gone through post-traumatic growth? So,
Hmm.
I'll probably finish with this thought is there's a difference between resilience and post-traumatic growth. And this is one of my more viral social media explanations. The trauma is the challenge that kind of sucks us underwater, and we don't have the capacity to handle it. And we feel like we're drowning, and it's just a lot. And resilience is when you recover your baseline and you're floating again. And sometimes that takes resources, whether it's like supports or
Hmm.
financial resources or psychotherapy, and you feel like you're floating again. And the definition of post-traumatic growth is learning how to swim. You're acquiring new skills. You're doing things in a new way. Instead of bouncing back to your baseline, which is resilience, you're bouncing different and you're bouncing somewhere else. And that's what we need to do collectively. We've encountered these collective traumas like the pandemic and climate and inequity that is affecting all of us.
Mm-hmm.
How can we collectively achieve post-traumatic growth?
Yeah. I love that. I love that thought. Um, well, Christy, I have thoroughly enjoyed this conversation. I have learned so much from you. I feel like I could talk to you for hours upon hours upon hours. I know there's
Thank
so
you.
much more we can probably touch on. So I did want to give you the opportunity. Do you have any last thoughts? And I know you've been talking about the Modern Trauma Toolkit that you published a couple years back throughout this episode, but anything you want to add about that before, obviously, I ask you where people can connect with you. So any last final thoughts or words?
I mean, my goal is to continue doing the one-on-one individual work, which I mean, I don't take patients because I work in Canada's public system, but my goal is to really do systemic based work. So, you know, I'm the Modern Trauma Toolkit, I think, is a really good primer for people to understand what's happening. Almost everything I mentioned is in the book. And then ChristineGibson.net is how to find me for the more structural work that I do. So I'm going to be launching teaching programs for practitioners and non-practitioners around complex trauma. I will be doing more on YouTube. I write a couple of Substacks. So if you want to follow me, that's probably like the place to follow the stuff that I'm up to. I really think the work needs to be done at this one-on-one level, but just like you're doing with your podcast, Jessica, is like reach more people collectively and try to shift consciousness.
Mm-hmm. Yeah, absolutely. So you just mentioned your website. Do you want to plug your socials as well? Where can people buy your book? Anything else? I mean, you mentioned you're going to be on YouTube. People can look at your website for all the cool things you're up to, but anything else you want to plug?
Yeah, like my website kind of hyperlinks my socials, so it's probably the
Perfect.
one-stop shop. But I'm TikTok Trauma Doc on TikTok, and then I'm Christy Gibson MD on YouTube. So those are probably the easiest socials to find me. I don't know why, like the stuff I do doesn't resonate on Insta yet, but maybe it'll pick up at some point.
It's,
I mean, I'm
yeah.
even on Facebook. So like ChristineGibson.com, uh, ChristineGibson.net gets you to my socials. And
Okay.
then moderntrauma.com is how to find purchasing for the book, but it's really everywhere. Like it's on Amazon and kind of all the big places where you would buy things. I also read the audiobook. So
Okay.
one thing that we know from polyvagal theory is that our tone of voice really matters. And I think one thing that helped me blow up on socials is an understanding of vocal prosody and trying to keep my voice really melodious and safe when I'm talking about trauma with folks. So I really was careful when I was reading the audiobook around how I sounded. So that's another reasonably safe way to explore trauma.
I love it. And I will link all of those in the show notes of this episode. But once again, thank you so much for coming on. Thank you so much for sharing your knowledge and insights. Like I already said, I could talk to you for hours. I know there's so much more that we could have probably covered, but I just appreciate all that you have shared today. I feel like you shared a ton of really good, useful information in the short time we spent together. So I just appreciate you being here with me and sharing your knowledge for my audience.
Well, thank you. Yeah, and I appreciate such thoughtful questions, which led to a really great discussion. Thank you.
And thank you, the listeners, for joining for today's episode of Psych Talk. And I will catch you in the next episode. Bye. Thank you for listening to today's episode of Psych Talk. Please rate, review, and subscribe to the show. And if you enjoyed today's episode, please share it with a friend. Don't forget to follow me on all socials at Jessica Lee, PhD, and the podcast at Psych Talk Podcast on Instagram.